Application of halo, including removal, cranial, pelvic, femoral. The physician applies a cranial halo to stabilize an injured cervical spine for radiography, traction, or to facilitate surgery. Indiana 20661. The physician places the patient supine, lying on the back, with the head supported just over the end of the stretcher. Skin and scalp are sterilized with a povidone iodine solution. The halo is positioned about the patient's head below the area of greatest skull diameter. A local anesthetic is injected into the areas selected for frame pin insertion. The anterior pins are inserted first, followed by the posterior pins. Two diagonally opposed pins are tightened simultaneously until all four engage the skin and bone. Using a torque screwdriver, all are tightened and secured with nuts or set screws before attachment to a traction setup or to a halo vest or cast. These procedures include removal of the halo. Application of halo, including removal, cranial, 6 or more pins placed, for thin skull osteology, e.g., pediatric patients, hydrocephalus, osteogenesis imperfecta. The physician places a cranial halo on the skull of a child whose skull is unusually thin because of a congenital or developmental problem. With the patient under general anesthesia, the physician sterilizes the skin and scalp with a povidone iodine solution. The halo is positioned on the patient's head with 6 or more pins, which are advanced until firm, but not to the tension allowed by a normal skull. Diagonally opposed pins are tightened simultaneously. All are secured with nuts. This code includes the removal of the halo. Diagonally opposed pins are tightened simultaneously. All are secured with nuts. This code includes the removal of the halo. Application of halo-type appliance for maxillofacial fixation includes removal. The physician places the halo for maxillofacial fixation over the patient's head and tightens 4 screws into place. The halo is connected to interdental fixation, which has the jaws wired together. Arch bars, IV loops, or other wires are attached to the teeth and wired together. For edentulous patients, without teeth, or partially edentulous patients, dentures or splints may be wired to the jaws first and wired together to provide intermaxillary fixation.